Good morning. I'm City and State's John Lenz, and I'm pleased to welcome everyone to today's panel discussion on prescription drug prices in New York. This discussion is hosted by City and State and sponsored by AARP New York, and it centers on legislation pending in Albany, where a state budget is due in just weeks. We've all seen the debates in Washington over how to address the high cost of prescription drugs, but today we'll hear from state lawmakers about what can be done right here in New York. Try to get to some of the measures that have already been enacted recently, but we'll focus primarily on a few specific proposals in play, how they might help, and whether they'll get done. We do only have 1 hour, so we'll get going right away here. I'll briefly introduce our panelists, and due to time constraints, we'll do without any extended introductions or presentations. I ask that each panelist try to keep responses to 2 minutes so that everyone has a chance to answer a few questions. Our panelists today are State Senator Alessandra Biaggi, who's a sponsor of at least one of the measures we'll be talking about today, State Senator Gustavo Rivera, who chairs the Health Committee, Assemblymember Rodney Bishop-Hermelin, who also leads the Brooklyn Democrats and is an ally of Mayor Eric Adams, Assemblymember Jessica Gonzalez Rojas, who is previously at the National Latina Institute for Reproductive Justice, Assemblymember Richard Gottfried, the longtime chair of the Health Committee, Assemblymember John McDonald, who is a pharmacist, Assemblymember John Salka, who is a registered respiratory therapist and has experience with hospital management, Assemblymember Nader Sayed, who has served on hospital committees and I believe has several children in the medical field, Assemblymember Michael Solages, who chairs the Black, Puerto Rican, Hispanic, and Asian Legislative Caucus, and hope we can hear about the impact on people of color in New York during this discussion. And finally, Bill Ferris, Senior Legislative Representative, AARP New York. Welcome, everyone. And let's go to Assemblymember Michael Solages.
And thank you so much. Thank you to all my colleagues. It's just, a pleasure to be in this forum. And speaking about this from a racial lens, affordable access to affordable prescription drugs is really a racial justice issue. It's an economic issue. People of color are disproportionately impacted by chronic illnesses and certain health conditions such as diabetes, HIV, hepatitis B and C, hypertension, diabetes, obesity, asthma, I can go on. And low-income individuals and communities of color are already besieged by poor access to healthcare, limited insurance coverage, and other health inequities. So when we talk about Godfrey's bill to expand eligibility for a Medicaid savings program, it's a win-win. This program will help individuals afford food, afford rent. So to me, it's common sense and something that we need to get done this year.
Great. Assemblymember Solages, over to you.
Yeah, definitely agree. There's much needed transparency and oversight needed in the pharmaceutical industry and drug pricing. Like more than half of spending on medication goes to someone who didn't even make them. So, not only are we looking at the pharmaceutical companies, we have to look at the drug supply chain, which include the health plans, the pharmacy, the PBMs, the pharmacy, the hospitals, the government, everyone, all the middlemen, and make sure that we really are looking at the consumer and uplifting the consumer, because the drug supply chain, 50% of the spending goes to them, and that's ridiculous.